Hello, you guys. I wanted to bring you along with me today. How are you? As you guys know, I'm an HCC coder, so I wanted to bring you along with me today as I was HCC coding. So I've already put the date of service, which was first, and you guys don't forget to like, comment, and subscribe. You know that's going to be my first thing I'm going to say once I put these videos uploaded and online. So please don't get tired of me saying it because I am going to say it. So I wanted to bring you guys along with me again today because I know a lot of you guys are going through the actual course right now. And I know for me, I didn't get a chance to see a live chart until I started actually coding for a company, until I started working as a coder. Before then or prior to, I've never saw a medical chart. I didn't see an encounter. I didn't know what it looked like until I started working in the field. So I like to do these videos so you guys can kind of get a glimpse of, medical charts. There are different EHRs. Some companies use eClinical, Athena Health, Practice Fusion, Cerna, NextGen, just a lot of different EHRs. So the charts may look different, but for the most part, the same components are going to be the same. And when I say components, like reason for the visit, chief complaint, assessments, and things like that are pretty much going to be the same. So when I put my finger on the camera, you guys, just know that I'm covering it up for a second, so I don't, show any HPI about a patient's date of birth or the doctor they're visiting or anything like that. So let's get into it. So it's starting off with the reason for the visit, and as you see, I have two screens here, so I work off two screens. So the reason for the visit is going to be an infusion visit. So the assessment is saying the doctor is taking this patient off of this medicine and starting on another one with an eye exam as well. So we talked about status codes in my last video about ICD-10 coding tips and documentation. So status code. So this patient is obviously on current long-term drug therapy. So this is going to be a code that is captured, long-term drug therapy. Z79.899, and remember your Z codes are your status codes, your encounter codes. So remember you guys, I'm a HCC coder, risk adjustment coder, so that's what I'm doing here today. And a lot of these rules also apply generally across the board, but there are some rules that only apply for risk adjustment. So number two, the number two assessment or the diagnosis is seropositive rheumatoid arthritis. Now, this first code, which is for long-term drug therapy, it does not have a risk adjustment score. And I'll show you what I mean. Let me go over here and show you what I mean. So Z79,899. Okay, so this is the screen that I'm working off of. Of course, they don't expect you to know everything off the top of your head by heart. That's why they allow you to use your books for your exam. So they don't expect you to always know which codes have HCC scores and which don't. But when you're used to HCC or risk adjustment coding, it's a lot of repetitive codes. You see you see a lot of the same codes. So you pretty much know what has a risk adjustment score and what doesn't. So let me enter this. So I am looking for my specific job of risk adjustment. I'm looking for HCC categories 24, 22, 21, and the prescription HCC category of 05. So if I don't have a score in either one of these boxes here, then that means that this is not what I'm looking for. This does not have a score. So I know this patient, like we just saw, has rheumatoid arthritis. So let's go here and let's see, does this risk adjust? And I know it does. I'm just showing you guys. Now you see how these boxes are for these first three boxes. That's what I'm looking for. So this has a risk adjustment score. So I'm going to go to my claim where I'm putting it on, and I'm going to add this M05.9 for rheumatoid arthritis because that's what the patient has, and it has a risk adjustment score. Okay, so I'm holding the camera here while I hide the other HPI. So as I go back here, now it's telling me the medications. I know this first one is usually for high blood pressure. Bayer, they usually, tell you to take Bayer if you're having little heart problems. We know Benadryl is for like allergies or anything. We know calcium is if you have vitamin D deficiency. I know cyclobenzaprine is a Flexeril. It's like a muscle relaxer. And I also used to be a pharmacy tech too, so there's a lot of reasons why I know a lot of these medications as well. So now we have a long list of medications of what the patient is taking. So remember, you guys, medications are also important. And like I said, I was going to hide my finger for a second, while I scroll through so you won't see the name and things like that. Okay, so here we go again. So there are more medications on the second page. There are medications and there are also lab results. Now you see here where the patient is 5'10". You see where the patient is 5'10", 160 pounds. Their BMI is 23. If you're working in a regular physician's office, a hospital, whatever you're coding, then you can use the BMI code to code whatever the BMI is. But if you're risk adjustment coding, I do not need to capture this code unless the BMI is 40 or more. So let me show you what I'm talking about, you guys. So you see, this is 23, the BMI. So let me move right here on this screen and let me show you how 23 doesn't risk adjust. You have to wait till you get to BMI of 40 or more for you to count it as a risk adjustment score. So I know that the body mass encounter codes are Z68. Like I said, I know a lot of these things by heart. So I think Z68 too should go into the 23. Look at you. Your girl know. That's why you should listen to me. That's why I'm the coding coach. Okay, so we find it here that Z6823. Z6823, that's the body mass of 23, what this patient has. First 4 boxes are not full, so I do not want to capture this code because it doesn't have a risk adjustment score. So let's say if my patient had a body mass of 50. So let's see what that looks like. Okay, so if they had a body mass of 50, you see how these boxes are full? It has a risk adjustment score. So again, you guys, if it has a body mass of 40 or more, then you're going to capture it for risk adjustment coding. So as I go back to this screen here, it's still showing results, lab results. So I'm going to put my finger up here again because I feel like there's a name that's coming up. So I'm going to hide my finger, and it was, okay. So we have more lab results. Finger again. More lab results. Look at, actually, and this is a 300-page chart, you guys. You see that I'm on page 7 of 305. So sometimes you might get long charts, and this is a 300-page chart. So, and it's broken up into different dates of service. This person this is a hospital chart. So if this person was in a hospital from Monday through Thursday, then it's going to be a lot of pages, but I am coding it per the date of service. So per every date of service, that's what I'm coding. So I have more lab results. It looks like this patient doesn't have anything else wrong with them, but let me check it out and see. Just be patient as I have my finger here. Don't get impatient with me. I've been teaching some good stuff these first 6 or 7 minutes, so be patient. So it looks like these are a lot of lab results. This patient, they wanted to be sure. Looks like they were running things to see what was going on. Maybe this patient was having things going on that they had never experienced or they couldn't understand. So let's see. Okay, so we get to another page. There are some more things wrong. So that's why you have to read every page in the medical charts, because you might skip something, and you definitely don't want to skip anything. So here we are. So remember on another video, I told you when you're HCC coding with cancer, the cancer has to still be active for you to code cancer. If it's not active, then you're not going to code the cancer. It'll be a history of, and history of codes are not going to have a risk adjustment score. So I see this person here has a malignant lymphoma. So they also have some knee problems. They got rheumatoid arthritis. So of all of these, there's only this one that risk adjust. Of course, the malignant lymphoma risk adjust as well. So it was active starting 2016. And here are some notes, non-Hodgkin lymphoma. So before I code this, I need to know, is this still active? It said it started 2016, so I'm not sure if it's still there or not. So what I'm going to look for, I'm going to look for the surgery notes or any surgical history, so to say, to see if it was surgically taken care of. If they made an excision and to take it out, take care of it. I'm going to look and see if it was radiation. I'm going to look and see, was it chemotherapy or things like that. So you see where it says procedures here? I know they had an appendectomy. Okay, so I know they had some optical issues. I know they had some surgery on their left hand for carpal tunnel. So now let's see, and I'm going to hide it again because I know the name is coming up. So what I'm looking for now is, I am looking for to see if they had any surgery for their cancer. Yeah, so I don't. And so remember at the beginning of the chart, they were coming for infusion. So now I get the understanding that the infusion they're coming for is for the cancers, for the lymphoma. So you see how it says the family history? The father had rheumatoid arthritis and the mother had heart disease. You see why these things are so important as far as family history? So if your family has things that you're having too, it's good to report it so the doctor can know kind of what to expect from your personal history by your family's prior and past history. So the father has rheumatoid arthritis, so does this patient. And the mother has heart disease. So for past encounters, you see this patient doesn't have much wrong with them. They have a long-term drug therapy and rheumatoid arthritis. So let's get to the good stuff. This is the meat of the chart. And I'm still within my 15 minutes. Okay, so this is the past medical history. They still have the cancer, so I am definitely going to code the cancer. I am going to code it. So I'm going to look up that code and I'm going to apply it. And I'm going to go ahead and speed through it to kind of give you an idea of what I'm doing. And I'll go back and apply my own codes once I get through kind of showing you guys what's going on. So jaundice, it's not risk adjustment. There's not a risk adjustment score. But if you were coding for a regular physician's office, hospital, or family practice, you're going to capture all of these codes. But remember, you guys, for risk adjustment, I only want to code the codes that has a risk adjustment score. So muscle spasm does not risk adjust. Nervous breakdown, it does not. Asthma or wheezing, it does. I know the asthma or wheezing code by heart. So that's why I'm going to go ahead and put this down. Like, I would have to look up the cancer code because you see it's telling the stage of cancer. And I want to be absolutely correct. So I would have to go up and look that. Go ahead after we're done with this video and look it up so I can get the correct code. But I know what the asthma code is. And to show you that I know what I'm talking about, let me show you. So I'm going to go here. And the asthma code is going to be J45.909. Because I don't know what kind of asthma. So it's unspecified. Look at you. Look, didn't I tell you unspecified asthma? It doesn't say anything about complications. So this is the code I'm going to use. You guys better listen. I know these codes, you guys. I know these codes. Okay, so let's continue to go through the list. Okay. So for the list, fracture. So they do not have fracture. And again, it says answer yes or no. It's probably telling me yes or no this person has or does not have these things. So if it has a no, I didn't need to worry about coding anyway. So this patient does have asthma, no fractures, nothing else. They do have hypertension. Hypertension also has a risk adjustment score. And if you do not believe me, let me show you. Here it is. I-10, essential primary hypertension. You see, it's in the last box there. So there it is. AIDS, they do not have that. Cataracts does not have a risk adjustment score. So psoriasis, that does have a risk adjustment score. And if I'm not mistaken, I think it's L40.9. If I'm right again, then you know, look, check it out, you guys. I'm right again. Didn't I tell you I know this stuff? But that patient does not have psoriasis, so I do not have to worry about coding. So remember also when you're HCC coding, you also have to go by the past medical history as well if it's a chronic condition. And also if it's cancer, you want to see if it's active or not. So stay tuned for the next video. Don't forget to like and comment.